Have you ever thought that applying antimicrobials to a healing wound can speed up the recovery process? This is a belief held by many, and it's easy to understand why. Antimicrobials, substances that kill or inhibit the growth of microorganisms, are commonly used in treating infections. Their efficacy in this area might lead one to assume that they would also be beneficial in the healing of non-infected wounds. But like many assumptions, this one doesn't quite hold up under scrutiny. Antimicrobials are a powerful tool in our medical arsenal, yet their use is not a one-size-fits-all solution. Their role in wound care, specifically in healthy healing wounds, is a bit more nuanced than commonly believed. This misconception, though widespread, can lead to misuse and unnecessary complications. So what does the science say? Well, it might surprise you. In fact, science suggests that using antimicrobials on healthy healing wounds might not be as helpful as we think. Let's dive a little deeper into this interesting topic. To understand why, we first need to grasp the basics of how our bodies heal wounds. You see, the human body is a marvel of biological engineering. When an injury occurs, a complex process called wound healing kicks in. Initially, blood vessels constrict to limit blood loss. Then, your body dispatches platelets to form a clot and create a protective barrier. This is followed by an inflammation phase where white blood cells, our body's microscopic warriors, rush to the wound site to combat potential infection. They gobble up bacteria and remove damaged tissue, setting the stage for the next phase, proliferation. During proliferation, new tissue is formed, filling up the wound. Your body's cells work tirelessly, creating collagen to strengthen the area. Finally, the wound remodels over time, restoring it as closely as possible to its original state. So, our bodies are well equipped to deal with healing wounds, but how do antimicrobials factor into this? While antimicrobials are great for eliminating bacteria, they don't discriminate between harmful and beneficial ones. Think of it like a garden. If you spray pesticide indiscriminately, it kills all insects, both the pests and the pollinators. Similarly, antimicrobials, when used on wounds, can wipe out both harmful and beneficial bacteria. Now you might be wondering, why are beneficial bacteria important for wound healing? Well, these friendly bacteria play a crucial role in our body's natural healing process. They help to regulate inflammation, promote tissue repair, and ward off harmful bacteria. When we apply antimicrobials to a wound, we disrupt this delicate balance, potentially slowing down the healing process. Moreover, overuse of antimicrobials can lead to antibiotic resistance, making it harder to fight off infections in the future. It's clear then that while antimicrobials have their place, healthy healing wounds might not be it. So next time you get a minor scrape or cut, think twice before reaching for that antimicrobial cream. So, what's the takeaway here? Well, we've debunked a common misconception that antimicrobials are always beneficial for healing wounds. The truth is, they're not always necessary and can often do more harm than good when used on healthy healing wounds. We dove into the science behind wound healing, explaining how our bodies are perfectly designed to heal themselves. Using antimicrobials on a wound that's healing just fine on its own can actually interrupt this natural process, potentially leading to longer healing times and even complications. We've also discussed the effects of antimicrobials on healing wounds. As we've seen, these substances can be quite harsh, killing not only harmful bacteria but also the beneficial ones that are integral to the healing process. It's crucial to stress that antimicrobials should be reserved for when they are truly needed, to treat infections, not to expedite the healing process of a healthy wound. So next time you have a healthy healing wound, remember, let your body do its job and save the antimicrobials for when they're really needed.